we use these events also as ways to not only share information, but to really connect with one another. I was chatting with one of our members earlier today, and she's interested in connecting with other Unite for Her members. And I said, we have this really great speaker tonight, and these are events where you can sort of engage with others and perhaps make that connection to people in your area or in your state or a similar diagnosis. So certainly feel free to connect with one another as well. We love that.
Yeah. The states are flying in fast and furious, and we are covering a lot. Missouri, Texas, Florida, PA. Yeah. It's always good to see. Yeah.
Yep.
So yes, so please use your chat. Erin and I will be on there, making sure that all the questions are delivered. And if not right in the real time, we'll catch them. Know that we'll catch them at the end. We do very good at that. Make sure, we all know the Zoom rules, right? Make sure you keep yourself on mute so that we can really hear our speakers. Really important for us to give them our full attention there. And of course, this is recorded. So if at any time you want to go back and revisit, just go to the Her Library. It looks incredible. Our communications team just redid it. I love it, Erin. I think it's so easy to navigate. So anyway, this is recorded. So just know that you can always go back. We always record it for a lot of our community that wants to jump in and look at it at another time. Tonight we have a really important topic, and none of these topics will be made possible without our presenting sponsors and our supporting sponsors. So Erin, how about if we do a nice little shout out to them?
Absolutely.
Beautiful.
We are so thankful, for their support. They continue to keep us moving forward and bringing topics, important topics like we have this evening and we're having through the entire month of April. So we want to give a big thanks to our presenting sponsor, West, Merck, and Daiichi Sankyo, and we have additional support from GSK and Lilly. So again, we could not continue to bring these speakers and these platforms and discussions to our Unite for Her community without them. So we are so grateful. And we do have some really great events coming up that I will quickly just tease before perhaps we get into some of the upcoming Unite for Her events that we have for our members fundraising. But we've got some really great things happening in April. I feel like I say that every month, but I truly mean it. So next week, we will have our virtual hangout. So that will be Wednesday, April 17th, 5 p.m. Eastern time on Zoom. And our topic for our virtual hangout will be all about body image. So we'll be joined by many of you know Dr. Monique Gary and Dr. Roseanne Guicheroux, and they will be talking about body image and the concerns that they often hear from not only the Unite for Her community, but their own patients. And they'll be sharing, it'll be discussion based, so there'll be a lot of conversing and sharing about how to improve a body image, tactics for sort of working through some of those challenges. So certainly come prepared with questions and perhaps engaging. So we're really excited about that discussion that will happen next week, and that'll be Wednesday. And then at the end of the month, again, new topic for us, Thursday, April 25th, 1 p.m. Eastern time, streaming live on our Facebook. We will be talking about oral health and the importance in the cancer community, which often goes overlooked. So we'll be joined by Jill Meyer-Lippert, and she'll be talking about the importance of oral health and why this should be in the forefront as you move through treatment or continuing on treatment. So she represents side effect support. So she'll be answering all of your common questions. She'll be sharing some of her favorite products and information and resources designed to help overall oral health, and products and information that can also support those being treated for cancer actively or those that are on ongoing treatment, and how the oral cavity can be affected. So lots of good information to be shared. And of course, as with all of our Ask the Experts, you can submit your own questions ahead of time, which we always encourage. So we'll put that link in our chat. And of course, just like this evening, both of our events will be recorded and in our Her Library.
Yeah, perfect. Erin, oral health, I can't get over how much it is overlooked and how valuable it is. So I love that the speaker is going to join our Unite for community and really give us some valuable information there.
Absolutely.
Really good.
Yep.
Yeah. And I have the honor, I can bring on our Director of Development. I think she's going to come on next before we head into our speaker series for this evening. So I'm going to add Cameron Cotterfellow. Hi there, Cam. How are you?
Hi. Hello, everyone.
Good to see you.
Good to
Thank
see
you for joining.
Good to see everyone in the chat. I I am amazed. This is my first speaker series that I am joining as a guest tonight. And I have just been sitting here smiling, looking at all of the different states, cities that are joining us. It's just an honor to be here tonight with our members and our community. So thank you. And before, yes, we get started on this incredible topic this evening, I would like to highlight some upcoming Unite for Her events that we have. Our first being one of our signature fundraising events, which is the end of April. And I think that Erin is going to pop the link into the chat, because even if you are not from the Chester County, PA, Delaware, New Jersey area, you can still join us virtually. Even from Los Angeles, which we actually have a model, one of our models, Bloom Fashion Show. So our 12th annual Bloom Fashion Show takes place on April 28th. And we have 15 inspiring, incredible members from our community that will share their stories and walk the runway in some of the latest fashions from our partners at Tish Boutique, Robert Graham, and Van Cleave. So that is April 28th. It is a joyous, inspiring, beautiful day, and it will be streamed live. So that link that Erin is popping in there, you can head there, purchase tickets if you are local, and you can join us in person, or be on the lookout for the streaming information and watch live with us and cheer on our members. So that is the biggest event that we have going on coming up. But we also have our calendar, because we have events that members put on. We have events that local schools put on all over the nation. So please, stay tuned on our social and on our calendar for events in your area, our area, nationwide, that you might be able to be a part of as well.
Thank you, Kim. I'm actually looking at Maria. She's smiling ear to ear. So we have one of our models in the audience
is she
tonight.
on? Oh, Maria!
Oh, yeah, she's here.
Maria, I saw.
And Sue, if I could add, like, what I tell my friends, if they don't want to donate to me directly, there's also like raffle tickets with fabulous prices. So
okay, there you go. There's
doing
Maria.
my job.
You're
Thank
hired.
you, Maria. You're hired. Yes, there are. And you do not, many of the grand prize raffles that you can find on that link, like Maria just mentioned, you don't have to be local to enjoy them. They can be done virtually or online. So there are many different ways to get involved with the fashion show that Erin, I see that there's the two different links in the chat, and any questions about any of them, please, feel free to reach out to any of us, and then it'll get to me and I can answer them for you.
Just watching the fashion show is so beautiful and inspiring, and I remember 4 years ago, we had to do this virtually, and when it was during the pandemic, and boy, that was it really spearheaded everything we're doing tonight, and having this virtual community and platform, and knew that we had a way that we could communicate that resonated and really inspired and empowered. So a lot of learning came out of the pandemic for us. And Cameron, thank you so much. You do an incredible job with our events, and please keep your eye on, this is a good group because they're on this speaker series tonight. So keep your eye on our reminders and join us. And then maybe you'll even be able to give Maria a little love when she runs her own little runway in Los Angeles,
all the way from LA. So yes, thank you all. Thanks for, letting me join you for a few minutes in the beginning. And I look forward to, hopefully joining again soon and seeing your faces again.
Yeah, beautiful.
Thank you.
All right, Kim, you got it. All right, Erin, are we ready? Should we introduce our guest?
Absolutely. I am happy to, and honored, I should say, to introduce Erin for this evening. And it's very few times that I get to introduce them with my own name. I don't feel like there's lots of Erin, so I feel super privileged. So I will happily share a little bit about our speaker this evening. So Erin Collins is the program director at the Peaceful Presence Project. And she's also a 2022 Cambia Health Foundation Sojourn Scholar. She is a registered nurse and a doula with 17 years of experience in oncology and hospice care. She is the vice chair of the National Hospice and Palliative Care Organization's End of Life Doula Advisory Council and a board member for the Oregon Hospice and Palliative Care Association. She is committed to educating the community at all levels to prepare for and talk about serious and terminal illness with compassion and tenderness. She empowers families to be present with their loved ones and believes that by talking about and planning for serious illness and death, we can ease much of the suffering that arises at the end of life. So it is truly, I think, our pleasure to welcome our guest this evening, Erin Collins.
Thank you for such a lovely introduction. I'm really just honored also to be here. What a great group you have. And I'm so excited to be able to share about the work that I do in the community. So I'm going to try to share my screen and I'll just ask for a verbal confirmation that that is good to go.
You got
Okay.
it. Yeah.
Great. So let's just go, let me go right over to this next slide here. So the organization that I have is the Peaceful Presence Project. We are based in Bend, Oregon, which is in the center of the state of Oregon, far from many of you, as I noticed in the chat. And yet we do work with folks all across the country. So our mission is to reimagine and transform the way that communities talk about, plan for, and experience serious illness in the last stage of life. And really that's our vision, based on our vision of a culture in which every community member receives compassionate and equitable support through the end of life. And we say through the end of life because not only do we try and really hope to work with people in health and at the time of diagnosis with a serious illness, but we also strive to support their family members. So beyond the time that someone is gone, that everybody who was in their caring circle continues to receive support to process that loss, and actually throughout the whole trajectory of an illness. Yes, there's a person who is diagnosed with an illness who is going through their experience, but what we also know is there are caregivers who are also having an experience with that serious illness. They're also grieving the loss of the way their life was before. They're also having the anticipation of what if. And so supporting individuals and families, chosen families, biological families, that's really all a part of our work. Pictured here are my two co-founders, Carrie Sims-Anthon and Elizabeth Johnson. As Erin mentioned, I am a nurse with experience in oncology and end-of-life care. Neither of my co-founders is. And so I'll really be sharing a lot about that this evening, that doulas are non-medical professionals and come from all walks of life and all sorts of lived experience. There we go. So our work is founded on what's called the Compassionate Communities Model of Care. And this is a kind of idea, philosophy, a theory of care that has been more widely proliferated in Europe, in Africa, in India, in South America. And what this model states is that an individual living with serious illness spends only about 5% of their time with their healthcare team. And so some of you might be saying, but I've been in the clinic. It was like I was there daily. I was getting radiation every single day. Well, even still, if you look at a 24-hour time period, it really averages out to about 5% of the time that you're with someone, with a medical healthcare provider. And that's even true for someone who is hospitalized. And I was just at the nursing ethics conference and we were talking about nursing care and how the percentage of nursing care, and nurses really provide or spend the most time with someone in the hospital. And yet that's still less than 10% of their shift is actually doing direct patient care because of how care has changed so much and all the requirements that they have. So the compassionate communities model asks the question, how can we as a community support someone the other 95% of the time that they aren't in front of their healthcare provider? And there's a lot of ways is the answer, right? And so I'm going to talk a lot about that through the doula model, but also for you to have the idea of how any community member who maybe has the skill set or has the lived experience of being with someone, and many of you fit this category, you've lived through serious illness. You have a lived experience of having metastatic cancer, and how could you support someone else who's been diagnosed? And I know you already do that through mentorship and pairing. And so in a way, many of you already work as doulas for advanced illness, but I'll tell you a little bit more about this specific role and folks who are filling this role. The other thing I want to talk about tonight is that, as you can see here from the wonderful author, Katie Butler, people who are willing to contemplate their aging, their vulnerability, and their mortality often live better lives in old age and in illness and experience better deaths than those who don't. And so Katie Butler had the lived experience of having her parents who were getting older and going through some advanced illness and then through a lot of medical treatments. What she found was that in the experience, when they hadn't talked about it at all, and they were thrown into an emergency and thrown into a situation that became quite chaotic, not having ever had a conversation was quite stressful. Not just for her, but for her father as well, not knowing, well, what would I do in that situation? And so then when you're in crisis mode and emergency mode, it's a lot more difficult to make good decisions and clear decisions. And so the idea of talking about the illness that you're living with now or an eventual illness, talking about it now can actually alleviate a lot of suffering. This is what I saw in my experience as a hospice nurse. And to be quite honest, I saw it in my experience as an oncology nurse as well. Folks who found themselves hospitalized with a cancer and had never thought about it before, and it was such a shock, and it was really confusing and overwhelming. So seeing that suffering, and then when I transitioned and started doing end of life care, I saw folks who had gone through an illness and then had never talked about the fact that they might die one day. And then when they were admitted to hospice, again, it was this chaos and this crisis and not knowing, and not really knowing how to prepare for the time that they were going to be in hospice care. And then there was a lot of suffering for themselves and for their family members. So I want us to talk a little bit about how do we talk about this and why do we talk about this? Because ultimately, talking about your illness and talking about the fact that we'll die, it's not going to kill us. And it's not going to talking about it isn't going to make us sicker. But talking about it could bring some ease to the situation and bring some ease into our care decisions. So looking at Peaceful Presence, my organization, and I just want to bring this up to step into the role of the doula, right? What we do as an organization, a lot of this is done locally, and a lot of this is done nationally with our education initiatives, just like tonight, being able to share about the doula model and being able to share about grief and about serious illness and care planning. We also do a lot of education for different healthcare providers, healthcare students, and community members. We try to get people talking about the fact that we are all of the nature to grow old. We are all of the nature to one day be ill, and we are all of the nature to one day die. And how do we get more people talking about that? We also provide care via telehealth. So we've worked with people in a number of states. We do care planning, what we call holistic care planning, and I'll talk about that a little bit later. And then we provide presence. And this is truly, I think, the biggest gift of the doula model is compassionate presence. Second to that is time. It's someone who's working or volunteering as a doula has time for you, time to listen, time to truly be present with you along the journey. So throughout your treatment, throughout your planning, and throughout the navigation of your relationships with your illness, your relationships with your healthcare providers, and your relationships with those who surround you. So what is a doula? Many of you may already be familiar with what are birth doulas. And that was really a model that emerged in the 70s and the 80s with the birth movement and midwives, right? So midwives and doulas were providing care in people for home births, but then also evolved to provide care for birthing mothers alongside healthcare providers. And now it's a really accepted and acknowledged model of care, or kind of an additional support person in the field of birth. About 20 years ago, some folks realized that this could also be really supportive in other areas of the lifespan. So for folks who become seriously ill, for folks who are at the end of their life, this same model of non-medical companionship could really be supportive. And again, it's really fits into that 95-5 rule of the compassionate communities model, that how do we support one another and what levels of support are available in that 95% of the time that someone isn't in a healthcare facility. Doulas complement, right? That's another aspect of this model, is it's complementary and kind of integrative, collaborative. So the doula does not replace any sort of medical care, but rather works right alongside the healthcare team. So if a person and a family are receiving curative treatment, the doula can be there to help navigate the system, to help provide advocacy and be a voice and be an extra set of ears, especially for someone who might not have anybody to accompany them to appointments. Doulas often go along and listen and make sure that you get the questions answered, or asked, I should say, that you're able to ask the questions that maybe you formulated in your head in the middle of the night. But then when you get to the physician's appointment and you have 20 minutes in the room or less, that, hey, remember, you really wanted to ask about this and this. We haven't done that yet. So being sure that the questions get answered. And truly, doulas provide a wide range of holistic service or support. So doula support can address physical needs. Are your symptoms managed? Are you getting through the day in a way that feels like this is okay, I can live with this, I'm doing great? Emotional support, right? You all know there's a lot of ups and downs when you live with a serious illness. And so doulas can be that big ear, the big listening ear, to provide just, just that presence and just the ability to hear you out without trying to fix anything, but just being the place that you can talk about anything. Doulas can provide spiritual support as well. We know that spiritual health is a big part of living with a serious illness. Dame Cicely Saunders created this model called the total pain model. And when you look at pain that you might be experiencing, it has a lot of sources. It's not just from a physical source. It's not just from the actual disease that you're living with, but there's an emotional component to pain. There is a spiritual component to pain. So what else is involved that could be creating some discomfort in your life, that if it was addressed, if you were able to talk about the kind of questions that, what brings me meaning and purpose? What is bringing me meaning today? How can I navigate and find meaning in what's happening for me? By addressing that and talking with someone, it improves the overall experience of living with the illness. And then 2 more really important aspects of the doula model. One is that practical piece. What do you need? You know, do you need groceries? Like, you are going through chemotherapy treatment and you know that Tuesday is going to be a really rough day. And so by Wednesday, you know, you're going to need X, Y, and Z. You're going to, you know, and something has to happen. Some sort of errand needs to happen, or you need to have groceries. A doula could be the person who helps you get that done. Connects you to other resources in the community, connects you with things like Unite for Her that they know about, that can provide that additional support that might be outside of the doula's scope of practice, but doulas tend to have a really good resource library. And then, as I mentioned, the advocacy piece, making sure that your voice is heard, that your values and your preferences are front and center throughout your treatment so that the treatment you're getting is aligned with the treatment that you want. So within the scope of practice of a doula, like I said, doulas do work with other caregivers and members of the medical team. Through that advocacy and making sure that your voice is heard, fostering self-determination, right? So really making sure that you're empowered and that you are making choices about your care, making the referrals, and then adapting the support, again, so that this is a person-centered experience. So I'm not going to take, you know, I don't have an agenda when I come in and support someone. I don't say, okay, first thing we're going to do is we're going to talk about your advance directive. And second thing, we're going to figure out what resources you need. A client, a person I work with might not need any resources at all. And in fact, they might just need a ride. So adapting, being truly adaptive to the unique needs of the person and their family each time, because we know that it changes and that things ebb and flow. And each time we're together, it could be very different. And so we're always thinking, what is needed today? But to be clear about that, the border or the line between medical and non-medical support, doulas are non-medical support providers. So no matter what area of the lifespan, right, whether they're birth doulas or postpartum doulas or illness doulas or end-of-life doulas, they don't perform clinical tasks. Doulas don't monitor vital signs. They don't administer medication. They don't give medical advice or persuade clients to follow a specific treatment or course of action. So again, the goal is to foster self-determination. And if somebody has a question about treatment, the doula is there to say, okay, let's ask the physician about this, or let's go online together and get some more information. Let's get to these other resources so that you can make an informed decision about that. Likewise, doulas don't impose values or beliefs on their clients, right? So that's something that is really important as well. Like I said, there's no agenda for the doula. We're truly there for the person themselves without judgment. We also don't undermine any confidence in a caregiver or a healthcare provider. So a doula is not there to usurp the role of other professionals. They're not there to say, "Ooh, did you hear what he said? I wasn't really sure about that." The doula is there on everybody's side as a member of the whole team. So as I mentioned, doulas can be there throughout the whole lifespan. And for adults, the ideal engagement with a doula is when someone is healthy, right? And so thinking about maybe it's just getting involved in some sort of community conversation or community education workshop. You know, just having a place and a space to talk safely about questions around serious illness or questions around end of life. That might be one place. Or in care planning, right? You can do a lot of advanced care planning while you're healthy. And I'll share again about that in a moment. But ultimately, when someone is diagnosed with an illness, is an ideal time to engage the services and support of a doula. That way, you have someone who can help navigate the questions, can navigate the white noise that we know comes with a diagnosis. Like I said, being sure that questions are always being asked and answered. So throughout that treatment, and that can, for however many years you're in treatment, having a doula as a companion by your side can be so beneficial. The other thing I like to say about that is that often the doula is the only member of the care team that is continuously present from the time that someone is healthy or at the time of diagnosis. Once you've established a relationship, that doula could be with you throughout your rehabilitation and recovery. They could still be with you then. If you became, if treatment was no longer your choice and you chose to go to hospice, that doula could be there through hospice. If you have family members, the doula can be there with your family members. Whereas there's a lot of care transitions that happen with serious illness, and you get different teams all the way. But the doula could be the one person who's there the whole way through, helping you to prepare, answering questions, doing additional education and support. So I've alluded a lot to what we call holistic advanced care planning. And so some of you may already be familiar with advanced care planning. If so, that's great news, because what we know is that the vast majority of the public has no idea what the term advanced care planning means. But this definition came out in 2017 by some scholars, and it's kind of the agreed upon and working definition of advanced care planning. And I just want to highlight that it's a process, that advanced care planning doesn't mean filling out an advance directive with your attorney when you're doing your estate plan. That advanced care planning is actually an ongoing process supporting adults at any age or any stage of health. So we talk often about when somebody graduates high school, one of the gifts should be, hey, we should start talking about what would happen. Well, I shouldn't say graduates high school, because now kids can graduate at 16 or 17. When someone turns 18, one of the greatest gifts would be for their parents to say, hey, let's talk about what you would want to happen if there's an emergency and you can't speak for yourself. What do you want to happen? Because at that point, they really can make those decisions themselves. So a process at any age or stage of health to understand and share your personal values, your life goals, and your preferences regarding future medical care. And the goal, again, is just, similar to the goal of working with an end-of-life doula, to ensure that you receive the care that is consistent with your values and your goals and your preferences during illness. It can occur, like I said, at any time in a lifespan. And this diagram was created by a mentor of mine, Seiko Izumi, and Dr. Eric Fromme, showing that healthy people, if you look at the green, it says naming a surrogate decision maker. Anybody can and really should have someone who will speak for you on your behalf in the case that you can't speak for yourselves. I think a lot about, I'm a nurse, but I'm married to a nurse as well who worked in trauma. He worked in a burn unit. He worked in the intensive care unit. And how often I would hear stories of somebody coming in and it was a terrible car accident. And that person now can't speak and they're having to make care decisions. So you need, having somebody who can speak for you is so important. Also, while you're healthy, completing the advance directive. And again, trying not to do it just with an attorney who says, okay, do you want this? Do you want this? Do you want this? This process of creating an advance directive is not just about checking boxes. I'm going to share a resource on my last slide for a more comprehensive advance directive that really helps you talk more about your values and your goals and your preferences instead of just checking boxes. Pardon me. And then this trajectory, once you've been diagnosed with an illness, there are goals of care conversations. Again, keep aligning, because that advanced directive is designed for when you can't speak for yourself. When you can speak, an ongoing conversation with your healthcare providers should be happening, right? Week by week, what is changing for you? Are you feeling better and want to do something different? Are you feeling worse and think maybe this isn't what I want anymore? That ongoing conversation about your goals of care. And then we won't talk tonight about the post, but for it's a form that's designed for someone of very advanced age or who is very frail. But those are the kind of decisions that if you go through this model and kind of talk about it, then when that time comes, it's an easier conversation, an easier decision making happens. So let's talk about the blue and the green, the healthy piece. So I like to talk about this in 3 components. One is thinking about it, identifying my goals and my values and my preferences. What really matters most to me? For me personally, it's the ability to go and sit out in the yard, to work in the yard. What really matters to me is being able to go and travel with my family and my teenage sons. Crazy as that sounds, they are fun to be around, even as teenagers. So for you right now, I ask the question, and maybe you even want to place something in the chat. What matters most to you? Like when you think like, oh, this life is good when I can. So go ahead and just say in the chat, like, what are some things? And maybe, Erin, if you're looking, you might just even share what people are saying, what matters most to them in living well, right? Like how do you define living well? What is really good quality of life to you right now?
Yeah, Patricia shares being in nature.
Mm-hmm.
Yeah. Traveling, being pain-free. Yeah, that's great, Kinka.
Really good one.
Mm-hmm. Low stress, being creative. We had another. Being active in a state of play. Absolutely. To not be a burden to the family.
Mm-hmm.
To be with family.
Yeah.
Mm-hmm. Play and read to my 4-year-old twins.
Oh.
I forget even when the cancer in those moments.
Yeah.
Oh, able to enjoy food.
Yes.
To
Not
engage in
drugged
deep
up.
conversations. Yeah.
Yeah. Beautiful.
Yeah.
So this is exactly what I mean. Like thinking about this all the time. And it's so easy, especially if you're in treatment, it's so easy to just be focused on the negative, right? And like, but to really focus on, what brings me joy? What matters to me? And then whether you have a doula involved in your care or not, being able to really keep that front and center so that that helps you to make your decisions. You're making decisions based on your quality of life and based on what matters most. And with a doula involved, right, finding those resources that allow you to do all of those things. And maybe that's, if you don't already have palliative care involved, maybe that's involving palliative care so that somebody's paying attention to like, okay, maybe we should switch this up because then you would still be able to go out and be in nature, right? So always keeping front and center what really matters to you so that that is what guides your decision making. The second component of planning is talking about it. So, like I said, having a decision maker, somebody who could speak for you if you couldn't speak for yourself, and also having someone who is there as the voice of reason, so to speak, so that when these decisions come up and they say, and you've shared, oh, this is what really matters to me, and they say, okay, what I've heard you say before is that it's really important to be able to be creative. And what I'm hearing from the healthcare providers is that if we go down this path, that's probably not going to be available. That's not going to be a possibility. So then that might guide the decision a little differently. And then really, again, talking about it with your providers, right? So that planning is that ongoing process, those ongoing goals of care conversations. So talking about it with your loved ones, but also talking about it with the providers who are giving your care. And then last, writing it down, right? So for future reference, so that you remember for yourself, oh, that's right. When I was really clear-headed, I said, I want to do this, this, and this. I will, now I'm not feeling so clear, but gosh, I really did write that down. Or you can't speak for yourself. It's in written form so that the person who you've named to make your decisions for you knows exactly what you wanted. And hopefully you had a conversation as well, but then they have the documentation to back it up. So those written plans come in kind of two forms. So an example of those two forms, one is the advance directive that I talked about. And although it's a legal document, you don't need an attorney to create an advance directive. But that advance directive has two parts to it. One is naming your healthcare representative. What gets confusing is that's got different names in different states. So sometimes it's a healthcare representative, sometimes it's a surrogate decision maker, but you're naming someone to speak for you if you can't speak for yourself, to carry out the wishes as you would want them, to make sure that your preferences for care are being met. And then, right, so it's expressing those preferences written down on paper. And so then they're helping to make sure that what's written down is what's happening for you. And then the second half, I put end notes here because it's the book that we as an organization wrote. But you can do this in a whole bunch of different ways. There's all kinds of online books that you can write things down in. There's websites where you can write things down. It could be just a notebook, with lined paper where you write out what you would want. And so end notes is a guidebook. We call it a guidebook because it really addresses practical and emotional and spiritual aspects of the end of life. So if that sounds like the doula model of care, it is, right? This was this guidebook that came together because we saw the things that people wanted to do when they were working with us that were really important. And so we wanted to create a simple place for people to do that work. So there's paperwork, checklists for paperwork, like healthcare paperwork you should have together, financial paperwork you should have together, legal paperwork. But then it goes into creating, if any of you have used a birth doula or you're familiar with birth doulas, they create birth plans, right? How do I want that day to go, that birth day to go? Now that plan doesn't always go that way, but having the idea and creating this kind of celebration and ideal picture for it is really important aspect. And even if it doesn't go to that plan, the doula supports the person in when things go awry. Well, we've created the same thing for someone at the end of life, or navigating serious illness even. Like, can you write down, it asks a question, how do you want pain to be managed? So if you want to be absolutely pain-free, even if that means that you have limited communication ability, then you write that down. If you want to make sure that you can still be lucid and have conversations, even if that means you might have to have a little bit more pain, then you write that down and you have that conversation so that then everybody's on the same page and there isn't a lot of disagreement around, well, I don't think she's treating her pain very well. I think we should be doing more. Well, no, it says right here, this is exactly what she wants. So those conversations that might happen out in the hallway, away from the person, there's actually some basis for your preferences. And then there's the kind of the pieces around your emotional health, and things that you want to say to loved ones. And then it really just creates this plan for where and how you want to be cared for and who you want to provide that care when you're dying. And like I said, it can also be a setup for serious illness, but the idea is that creating this more of a celebration and more of a plan and more of an ideal situation, because there is that contemplation, it really does help people living with serious illness to feel better and to alleviate stress and anticipation. So if any of this is sounding like logical to you and like, okay, yeah, I get this, you might then ask, how do I even begin to talk about this? We often think that nobody wants to talk about any of it, but the numbers tell a different story. 92% of Americans believe and say that it's important to discuss their wishes for end-of-life care. And these are folks living with illness and not living with illness. Only 32% have actually had a conversation. So we all think it's a good idea, but there's still a little bit of a, to talk about it. So 95% of Americans, though, say they would be willing to talk about their wishes. And 53% say they'd be relieved to discuss it, right? So it's like this thing that we all know. We know it's like the elephant in the room, and we know that we should talk about it. We know that we would really like to talk about it. And yet we all believe that nobody else wants to talk about it. It's kind of that taboo topic. I was a speaker at a kind of a conference for cancer advocates and thrivers in January, and there was a young woman there who was living with cancer, and I think she was 31 years old, and she said, how do I get my family won't talk about this. I tried to talk to them about it. I want to have a plan, and my family says, no way, they don't want to talk about it. So maybe just going into the topic and essentially forcing it a little bit, maybe they would start talking about it. I had a gentleman on a webinar last fall, and he said, my mom, she doesn't want to talk about this. She just wants to pray. She just says, I'm just going to pray for you. I'm just going to pray for you. And he said, how do I get around that? And so what I offered was, well, what if you said, I'd like you to know what to pray for? And that felt really relevant to him. He was like, oh, sometimes we need to shift into the other person's language. So the Conversation Project is an organization who did this survey, and I'm going to share a couple of their conversation starters, and then we have some links for you as well, but just a couple of ideas. I was thinking about what happened to my friend Robert, and it made me realize that that's not what I would want to have happen at all. And that might open the conversation. They might say, oh yeah, I was thinking about Robert too, and that was horrific. Another way is, even though I'm okay right now, I'm worried that I could get much sicker, and I want to be prepared. Can we talk about some things that matter to me? Right? So all those things that we just shared in the chat, all those, the things that define your quality of life and your values. Can we talk about my values? Can we talk about what quality of life is for me? This is what matters to me, and I want you to know, so that if I get sicker really quick, you're able to help me get the care that I want. So the other thing is that today is April 11th, and in 5 days is annual National Healthcare Decisions Day. So this is really timely. And so I wanted to give you some ideas for how you might celebrate National Healthcare Decisions Day. One of those is to find a doula to work with you. There's a link here, and I believe you'll get a PDF of these slides with live links. The National End-of-Life Doula Alliance is the top link there, and it has a directory state by state. So you might be able to find somebody who's nearby. You might want to start an advanced directive, so you can download an advanced directive form. And this is the one called Prepare for Your Care that I mentioned, which isn't just a bunch of check boxes, but it really gives you space to identify and work through your goals, your values, your preferences, so that when that someday comes, your care is really aligned with what your preferences are. And you can define your values and preferences in a state of health and think about how that might be different in a state of illness or advanced illness. There's a link to our guidebook and notes. And there's even more conversation starters at the Conversation Project. So the link that says have a conversation is just this conversation starter guide. But there's another kind of journaling opportunity, and this might be a really tangible place for some of you to start, just to start writing about your values and your goals and your preferences, just to think, like, get you thinking about, yeah, what do I want? What does matter to me? And so that link there goes directly to a PDF of a workbook that lets you start thinking about what matters to you. And finally, this is my information. This is our website and how you can reach out to us via email. So if there's any way that we can support you or connect you to someone nearby, we have a network of people who have trained with us as end-of-life doulas. We have folks who are colleagues that live all across the country, or if we can just answer any questions, don't hesitate to reach out. I'll stop my screen share and we have a little bit of time for questions if there's any.
Yeah, we do have questions.
Okay,
Yep.
good. I hope I left enough time.
Yeah, I'll start. Erin, I'll pop all the way up to the top because I wanted to make sure we don't miss anybody. One of the
Great.
questions was, tell me the difference from palliative care. And this is actually a topic I'm going to discuss with you later for our NBC Alliance project that we're working on. So can you just address that a little bit?
Yeah. So palliative care is designed to be provided right alongside curative treatment. And the idea about palliative care is it's a whole person model. So just like the end-of-life doula, right? Addressing spiritual and emotional and not really the practical needs, but palliative care really wants someone to have the highest quality of life while they're living with serious illness. So throughout their treatment, making sure that your symptoms are well managed, that you're able to do what you need and want to do day to day. And so the way that there's inpatient, so there's often palliative care within a hospital that's sometimes focused more on pain, but there's also outpatient palliative care, clinic-based, and sometimes there's home-based palliative care. And the only thing is that it just really varies place by place what's available. So some teams will have a physician and a nurse and a chaplain and a social worker. Some will be a little more bare bones, but ultimately it's a specialty type of care that makes sure that every day you live with serious illness is as high a quality as it can be.
All right, thank you, Erin. I know that we're going to be diving deeper into palliative care because a lot of our community feel that the services of Unite for Her help them so much that it gives them this type of care and this type of support and gives them the quality of life, and it's all covered and paid for. Palliative care in the hospital setting is covered and paid for, correct?
Yes, and so palliative care is provided by Medicaid, Medicare, and most private insurers because they know that it helps to decrease the costs overall. It decreases, decreases emergency room visits, right? Because we're addressing any issues or symptoms that come up before they become crisis level. So most insurance will pay for palliative care.
Okay. All right. Thank you.
Yeah.
We had a couple questions just about people in the audience that are interested in about doulas and how they are compensated. So I think twofold, is our doulas actually covered by insurance?
Mm-hmm.
And also, what is the fee?
Yeah. So one, no, doulas are not covered by insurance yet. We're working on that, and in Oregon, we're working on some advocacy around Medicaid and Medicare reimbursement, but we're not there yet. So for example, our organization, we're a nonprofit organization, and so we charge a sliding scale for our services, meaning basically pay what you can. And then as a nonprofit, we have foundations who have really believe in the concept. And so in certain rural communities in Oregon, we're able to provide doula services free of charge. And then we're able to provide them anywhere free of charge because of individual donors who have contributed to our Compassion Fund. That's not true of every organization. So again, this is something that really varies based on where you live, who's available. But what I will say is that I truly believe that most end-of-life doulas, most doulas, they may call themselves end-of-life doulas, they might call themselves death doulas, they might call themselves serious illness doulas, but most doulas will work with you and negotiate their price. Most doulas are wanting to be supportive and wanting you to have the support that you need, and will negotiate or offer pro bono services. So it's all over the board, anywhere from $25 an hour to over $100 an hour, just based on the environment in which you live and what that individual doula charges. So.
Yeah. Erin, do you think the best way for our community tonight is to just connect with you and find out where they live or how they can get in touch with someone? Because we have people from all over the nation, right? You saw all the states that are here.
Yeah.
Just to get, it almost feels like we know if we connect with you, you'll be able to direct better than trying to search the web. Does that make sense?
Yeah, what I would say actually is to start at that the link I shared that said find a doula, starting
Great.
at that National End of Life Doula Alliance, because that will immediately get you who's in the area, right? That'll immediately show you, oh, there's 5 people here, or there's nobody nearby. I think that's the place to start.
Okay.
If that is a dead end, or you just think, okay, I'm not really sure about, there's these 3 people and I'm not really sure, then feel free to reach out. I'd be happy to kind of give you some questions to ask or help you vet people just to see. But that's what's really important, is finding someone who's a good fit, right? Who
Yep.
feels good, who provides the services and the support that you want and desire. That's more important than anything, really. So I would say start with the directory, see
Great.
if there's somebody nearby, and then I'm happy to support with that.
Terrific. Thank you.
Wonderful. We had a question that came in, Erin, and it was centered around if, and this may be in some of those states that have laws that are around death with dignity, but if a patient is making that decision for themselves, can a doula play a role in supporting the patient in that decision and their family?
Yes, absolutely. And so medical aid in dying, as you may know, I'm going to apologize in advance. My dog is just freaking out because my husband is just getting home. So if you hear the dog bark, I apologize. We're still in Zoom land. But yeah, so medical aid in dying, there's 11 states plus Washington, D.C., where it's legal, 2 states where they don't have a residency requirement. A doula is a wonderful support through that process, through navigating the decision-making process, getting information. Some states, like in Oregon, we have a volunteer organization that provides support and helps people get connected to prescribers. Some states don't have that, so doulas are very supportive. And doulas, not every doula, I wouldn't say it's not a required in the scope of practice, but many doulas will be there and help you to make the decision and then to choose or to ingest the medication to end life.
Okay, thank you.
Yeah.
And I know we had another question that just talked about those that were interested in training and good training programs, or someone is looking to become. Can you make any suggestions regarding that?
Yeah, so obviously I'm happy to recommend our training program. And you'll have the link to our website, and I could even put it in the chat. So checking out ours, we do a facilitated course several times throughout the year where we have some live Zoom sessions, and then there's a lot of work on your own that goes over 8 weeks. And then we have a self-paced version of that as well, so people can do it on their own. That being said, there's lots of training organizations across the country. And so on that National End of Life Doula Alliance website, there's also, when you go to the page, there's also a spot that says find a trainer. And so you can go on there and explore. And again, just like finding a doula, I think finding a training that really aligns, that really feels like, oh, these are my people. This is who I want to learn from. That's what's really important. And so on our site, you can check it out. We call it a free info session. And there's a little video on there that people can watch to learn more. So let me just put this in the chat now, and then.
I did put it in for you, Erin.
Oh, you did? Okay, thank you.
Yeah.
Yeah.
And
Thanks,
we have
helpful.
we have a very quick crew, because every time I try to put it in, Erin had it or one of our members had it. I'm like, oh, they are on it. They are on it.
That's great.
Yeah.
Yeah. So anything else?
Yeah, we did have a couple more. Let me just
Okay.
scroll back up, because I just want
Yeah.
to make sure we get to all of those questions.
Absolutely.
One of the interesting thing was that some of the community agreed that their palliative care only prescribed pain meds, nothing else, and that seems unfortunate. I felt like there were other areas that they would be able to administer, give resources.
Yeah, and unfortunately, I think that's true, especially in a limited resource area or a limited resource program. Palliative care might just be, for example, where I live in Oregon, the eastern 2/3 of our state is rural. And much of the state doesn't have any palliative care, it doesn't have any hospice. But if you look at the map of palliative care providers, if one person in a hospital has done a palliative care certification, that's saying that, oh, they have palliative care is provided there. So I think in some areas that might be the case, where that's all they can really provide is pain management, or maybe it's just kind of not an understanding of the full breadth of the scope of palliative care. So it's worth asking, if you're only getting pain management from your palliative care provider, it's worth asking, hey, is there a chaplain available? I'd really like to be supported, in my spiritual health. And they may say no, that we don't have that, but just asking about it might start to get people thinking like, oh, we do need to provide more services. And again, that's a great opportunity if there's a doula in your area to get more of that wraparound support, more of that whole person care.
That's great. Thank you.
Mm-hmm.
Yeah.
I think I did look everywhere, Erin. I didn't see anything else. Did you see anything else?
I did not. I think we actually covered all of the questions. Lots of inquiries about, the reading and your end notes book and how to find someone in their
Really
area.
beautiful.
So yeah, we will definitely share all of the links that Erin provided with the recording. So know that they will all be made available, and we have them in the chat as well.
Great.
We could even put her deck with the recording, right, Erin?
Mm-hmm.
Yeah, we've had a couple of questions. I actually have a question. It's from me. So when you were talking about the advance directives and doing those, I always felt like they needed to be a legal binding document, because you're sort of giving this to your healthcare provider. You're giving this, is that the case? Or
so it is a legal.
These end notes, like the end
Yes.
notes that you have, is good enough to just give this to?
So EndNotes itself is not. So EndNotes itself, the guidebook that you go through and say all the additional things, that's not a legal document. That's just a kind of a guidebook for your loved ones. But completing an advance directive, that is a legally binding document. So it's a legal document, but you don't need an attorney, right? And the signature, or kind of the signing, is different in each state. Some states require a notary to, when you sign your advance directive, they require it to be notarized. Many states just require 2 witnesses who know you to say, yep, that's the person that they signed, these are their wishes. So that is indeed a legal document. So at the hospital, if they have that legal document, they need to follow the wishes that you have written out and signed to.
In your endnotes. Okay, so you need both
And
of
then-
those documents.
And then endnotes would be, what endnotes does is there's a checklist that says, okay, for your healthcare documents, do you have your advance directive? Check. Have I named a healthcare representative? Check. Where's my insurance information? Check. So that's kind of it's just a place to gather all that information into one place. And then to go deeper into the more heartfelt and spiritual and emotional work around creating a plan for that time period. So that book is not legally binding.
Okay, I just wanted to be clear that we needed both of those
Yes.
items.
Yes.
Okay.
Great.
All
Thank
right.
you for clarifying that.
No, it's all good. Yeah. Thank you so much, Erin. We really appreciate
Oh,
you
thank
tonight.
you. So pleased to be
Yeah.
here with you all. Thank you for showing up.
You got it.
Thank you.
Yeah.
All right, Erin. I think that's another really valuable speaker series that we were able to bring to our community. We did have a lot on here tonight, so we will continue. If you have anything else that you feel like you would like us to cover, we are here for you. We're here to learn with you, right by your side, and really find the best possible presenters and speakers and professionals that can guide you in the best way. So we are open. Please shoot us an email. We know we will always
Absolutely.
listen to our community.
Always.
Yeah.
Mhm.
And I think
Wonderful.
one more shout out to our community sponsors, our presenting education sponsor, which is West and Merck, and then our supporting sponsors. We're so grateful for Daiichi Sankyo, GSK, and Lilly. They have just been a tremendous support to help us bring more and more of these types of series right to your home. Yeah.
Yep, absolutely. So hopefully we will see you at our virtual hangout next week and our Ask the Experts later this month. But know that, again, this recording will be on our Her Library tomorrow with the links and the slides from Erin. So we have all of that coming to you so that you can share, re-review, or perhaps start your own conversation at home.
Perfect. All right,
Wonderful.
Erin. Well, have a good night. That is a wrap for our April speaker series, and we look
Yes.
forward to seeing everybody soon.
Yeah. Thank you so much, everyone. Thank you, Erin.
Ready?
Thanks,
Yeah,
everybody.
thank you, Erin. Yeah, bye-bye.
Good night. Bye, Mary.
Bye-bye.
Good night.